Welcome to the Tiny Titans podcast. My name is Katie, and this episode is me processing verbally out loud in real time how I was just diagnosed with EDS hypermobility and how my daughter Carter, I thought, was going to get a cerebral palsy diagnosis, and she did not. And we will start at the beginning. Hi, I'm Katie, 3-time NICU mom turned medical mom turned podcaster. I've spent way too many days in the NICU, and it's changed my life forever. I've been the terrified mom with 1,000 questions and no one to ask. So now I talk about it. On the Tiny Titans podcast, I say the quiet things out loud. NICU guilt? Yeah, we go there.
Mom guilt for sure.
God moments? Absolutely.
God, no.
That's wonderful.
This space is for NICU parents and the people who love them. Let's tell the truth. Let's tell the stories and let's pass them on so the next NICU parent knows they're not alone and maybe finds what they need just when they need it. Like and subscribe if you're on a NICU journey too. You're not alone. Welcome to the Tiny Titans podcast. I am so glad you're here. So recently, this week, last week, I was diagnosed with Ehlers-Danlos hypermobility. And my geneticist was like, I'm pretty sure you have this, and we're going to do labs to back it up, and if you're deficient in these things, then it's probably this. And that's what happened. So I have a diagnosis, and at the same time, Carter, what I thought was going to be getting diagnosed with cerebral palsy, this would be her follow-up to find that out, and she does not have cerebral palsy, which is a good thing. This is a good thing. It's not a bad thing. I understand that it's not a bad thing. There's just a lot of emotions and processing, and so this episode is, I just need to verbally process all of this information, and it's important to the NICU story because in my case, this Ehlers-Danlos is probably contributing to the incompetent cervix, which caused my preemie babies. Also, contributing to like how hard it is for me now to recover from my pregnancies, which hadn't been difficult before. So it's just like a lot of information. And then thinking that we're going to find out the reason for Carter and give her a diagnosis. And then we really have to start back at square one. So that's what this episode is about, is a continuation of infertility and premature births and our NICU stay and diagnoses and therapies and where do we go now. So the whole story started because we had Carter in early intervention, and so her therapist at that time were coming to the house. Her developmental therapist was watching me with Carter one day and said, has anyone ever mentioned Ehlers-Danlos syndrome to you before? And I was like, no, what is Ehlers-Danlos syndrome? And she sort of explained, and if you do not know, it is a disorder of the connective tissues. So my understanding, I've looked it up a bunch since, but my understanding is that your body does not produce the correct nutrients to keep your body healthy. And so it's one of those things that is different for everyone. Everyone can be deficient in different things, but I'm just going to talk about my case because we checked for all of the different syndromes and the different types of EDS, and so I know more about obviously what I was personally diagnosed with. And then we kind of have like an idea of maybe that Carter might have it because she has a lot of the same symptoms. But again, there's just a lot of overlap. So we're going to have to do this one step at a time. So I was in the developmental therapist session, and she asked me if anyone had mentioned Ehlers-Danlos syndrome to me, and I said no, and I sort of did like a little research after we talked about this, but she was like, can you do this? And she gave me a whole list of things. What are the things that she did? She just had me stand and lock out my knees, and that's hypermobile, and my elbows are hypermobile. Like, we don't need to go through all the things. Like, I can do all the party tricks and stuff. It hurts sometimes when I do it, but I've got all of the elasticity. And then what was more concerning was that I have like the heart palpitations and like dizziness standing up and those kinds of things, which is kind of part of the cardiovascular side of Ehlers-Danlos. But I already got the echo, and so far, so good. It's just that if you have EDS, you can have like a wide variety of symptoms because your connective tissue connects everything together. So the more I read about this, the more I was like, this could be why this, and this could be why this. And then the big flashing alarm for me was when it started bringing up infertility and incompetent cervix and premature births. And I was like, hold on. I may possibly have something that's wrong with my person that contributed probably a lot to the prematurity of all of my children and all of the stuff that we went through in the NICU. And we can what if that to death, but let's not. Let's not what if that to death. We're just going to go over, the facts. The facts, what do we know, what don't we know, and we'll keep going. So that's how I discovered that I could have it, was our developmental therapist. Then I was trying to figure out what to do with this information. So I held on to it for quite a while, probably longer than I should have, but we were going through diagnoses with Carter and physical therapy and Cassie getting an increase in her asthma dosage, and like other life was happening. And I was like, I don't even know if I have this. I don't know if this is something I need to put a lot of weight into. And then just like a lot of the dots started connecting. So, when I found out that all of these things could be like tied together. For example, another symptom of mine is that I have had past GI issues and seen a GI doctor, and I've done the endoscopy and the colonoscopy, and it's super duper fun. But in my case, after finding out like the little tiny things that were sort of wrong, I was able to fix that with diet and hydration, a little bit of medication. Which I found out that certain medications that I was on from my GI doctor make me faint. I did not know that. So, which is also a symptom of EDS. I did not know that either. So it's just like really tiny, weird little things that now, looking backwards, I am like, oh, that and that and that and that. So the biggest piece to me that's like most concerning, because it's not affecting me, it's affecting my kids, is the prematurity part, because I didn't know that I had that issue, and so then they may have this issue. Do you see what I think you see where I'm going with this. So I went ahead and made an appointment, which it's a specialist, so you have to wait for months. And I ended up scheduling it at the same time as I had to schedule Carter's MRI because we did it last December. It's December, so we're doing it again. And I needed to do it that way a little bit also because we don't have childcare, and so my mom was going to come and stay with us for a week while we do all of these appointments. So I did it on purpose, but I guess I just wasn't assuming it was going to be like as overwhelming with all the information, because when you get like this Ehlers-Danlos diagnosis, it's like, here are all the things that you do have, here are all the things that you have to watch out for, and you need to find the correct like concoction of supplements that is right for your body to get better. What is it that your body is deficient in? What is it that you can add? How are you going to choose to do that? And then like, can you follow through with that plan as a person? Because I'm a mom of 3 kids, so it's not like I have like a ton of time to meal prep for myself. I can't make 4 different meals every single day. I will die. I can't. Which chronic fatigue is part of Ehlers-Danlos. It's so funny. Anyway, so when we had Carter's MRI and the MRI came back that she did not have cerebral palsy, yes, that is a good thing. I'm glad. I am glad that she does not have a brain injury, obviously. The giant red flag for that situation, it is time for our very important preemie VIP, and today's VIP is Mr. Grayson. Mr. Grayson has been in the NICU his entire life. His whole life. And he just turned 1 for 365 days. This kiddo is super duper strong. He has been through a bunch of procedures and surgeries. He now has a tracheostomy and a G-tube. He has some more procedures that he has to have before he can go home and be with his family. So Mr. Grayson is fighting super duper hard, and he's spent his first birthday. He is about to spend his Christmas, his second Christmas in the NICU. They wear size donation to GoFundMe, which I will link below. Is that she still has all of the same symptoms. She has all of the same gaps that we were watching for and looking for last year. She has not gotten better. In fact, the gaps have gotten bigger, and it has become more apparent where she is having issues. So in Carter's case, we can go over her symptoms. She falls a lot. She is hypermobile, super flexible. Her body falls out of alignment, so we go to the chiropractor like twice a month for that. She has sleep problems. She has breathing problems, but she also has bronchopulmonary dysplasia. So I don't know. Carter is a giant question mark because, and I'm sorry if I'm going all over the place, but remember, I'm verbally processing this. Like, this is real time. I'm real time processing this. Carter is a giant question mark because she's 3, so she's not really old enough to get an asthma diagnosis, which we're working on, an autism diagnosis, which we're working on, or any other sort of like neurological or developmental diagnosis, because she's in like this weird gray area. She can walk, she can talk, she sort of communicates when she wants to, and the when she wants to is that autism, is that fatigue, is that muscle spasming. She has drop foot, she has weak ankles, she falls constantly, she's off balance all the time. Honestly, if you watch her walk, she looks like a scarecrow. She looks like she is loosely put together. And I, at this point in time, do not know all of the physical therapy things to make her strong in the correct way. That's also not going to hurt her, because if she is also found to have Ehlers-Danlos, then we need to make sure that we don't hyperextend her, that we don't push her too far. And if Carter can't communicate when she's in pain, when she needs a break, then it could be very easy to push her too hard, and I don't want to do that. So I really need to do like a ridiculous amount of research first of all. I did go ahead and talk to Carter's developmental therapist, who she had with EI, and she gave me a lot of ideas of where to go forward with a rheumatologist or you know what, we'll Google it, but or a geneticist. But also, my question is, what are they going to give me? What information are they going to give me that I don't already know now? So, like, all of these specialists from where we live is like an hour to an hour and a half drive. So I'm constantly weighing, is this information worth it for me to drive an hour, hour and a half one way and then back and basically spend most of the day away from home and figuring out childcare for the other kids, or have the kids come with us and do lunch in town, and does everyone have enough clothes? It's a lot. It's a lot, and I'm super proud of any mom who constantly takes their kids out all of the time. It's overwhelming for me, and I'm going to be super honest about that. It's super overwhelming for me to take all of my kids out all the time. I have to do it. I do it regularly, but if I don't have to, what can we do instead, you know? So I'm trying to figure out what the in-between options are. Is it like we could see a physical therapist and a developmental therapist maybe once a month on the same day, and then like work on all of those like exercises, stretches and things in that routine for that month, and then see them again to kind of like reevaluate. Also, because she doesn't have a diagnosis, like the diagnosis piece, I'm not fretting on it because of a label. It's just, in my case, the diagnosis piece explains a lot. It explains my crazy menstrual cycles. It explains everything. It explains everything for my whole life. It explains all of it. But without Carter having a diagnosis, it's harder to get help for her, especially through our insurance. So right now, everyone who is a professional would tell you she does need physical therapy. She needs work on these muscles, these muscle groups, and all of these things. But insurance is going to say, what's her diagnosis that would make her need that physical therapy? Well, she was born premature. That doesn't really cut it after a certain age, which is really annoying, but it doesn't. It doesn't cut it after a certain age. So, the problem then is, how do I best move forward for Carter? Because we also don't have a lot of these services in our area. We need to go somewhere to do that. So then, do I pay extra because it's probably going to be out of pocket to have someone close? Do I pay out of pocket to go to like a clinic at a bigger town that would have multiple therapy services and try and schedule all of that at the same time? There's like a lot of questions, first of all. That's what I'm finding out from this. Me getting a diagnosis and Carter not having a diagnosis is bringing up a lot of questions of what do we do now? And no one has like a plan. There's no like care plan. There's no like, oh, you got this diagnosis, but you didn't get this diagnosis, so this is what you need to do to move forward. So that's like where I'm stuck, because I can do all of the things. I feel like I need to do all of the things. I need to do like more than I'm already doing. And I'm hoping that, so in my case, for my EDS, I'm deficient in B12, vitamin D, iron, collagen, obviously. And what's the other one? I can't remember right now. Iron, DB, collagen, and something else. Anyway, magnesium. And so that's why I feel crappy all the time. That's why I feel gross. That's why I feel especially gross when I'm on my cycle. And that's why I'm feeling continuously gross, because I had Carter prematurely, and then 9.5 months later got pregnant with Colby and had her prematurely. So my body was like, pregnant, not pregnant, pregnant, not pregnant. And then I have EDS on top of that. So my body is unable to put all of the resources, put all of the nutrients back in my body on its own. I didn't know that. I didn't know that that was going to be a thing that was going to happen. So now that I do know, and I know what I need to take to fix that and balance everything out, I can start doing that. I can put all these pieces back together and start fixing my tissue that way. I also, oh my Lord, it's fine. We'll fix it in post. So I also am going to go back to paleo, because I was feeling, I did paleo when I was going through infertility with Cassie and Carter and Ava. Cassie and Ava, and then a little bit with Carter. Carter was a surprise, so I was sort of getting back to it. But with Cassie and Ava, I had infertility issues, and I was doing paleo diet to help with those issues. So I'm planning on going back to that because I felt really good on that. I like those rules. They're kind of easier to follow. I don't nitpick and do like a bunch of fancy paleo recipes. I keep it really easy, like carrots for a snack all the time. I also may or may not have ADHD. I don't know. It's been whispered to me that it is another thing that I may have that I might need to see a specialist about. Also because my brother also has it. So, anyway, because of that little thing, I like to eat the same thing until I don't like to eat it anymore. So, right now, that's carrots. And so, that was like, that's paleo. Yay. Go me. I have to stop Dr. Pepper. I don't want to. I'm gonna slowly back off of it. Hopefully. It's gonna be hard. I don't know. I'm already starting to see like parallels between when I have like 2 Dr. Peppers in a day and the next day I feel real gross about it. And I like to remind you that I'm 36. So like I'm gonna be 36 in a week, in 10 days. I don't know. 8 days. Yeah, in 8 days. So, yeah, I feel real gross. But I love them. I love Dr. Pepper. I like it. I like it a lot. It's a real problem. I'm gonna have a problem with it. I'm trying to, like, supplement it with coffee right now because I also love coffee. But, I don't know. I get bored with coffee easy. Maybe I should just, like, up my coffee game and make, like, a little coffee corner nook with like, ugh, I'm not supposed to have sugar, so I was about to be like, not all the fixins and all this stuff. Never mind. Can't do that. Rules. So the thing is I want to feel better. I hate that I feel gross. I hate that I can't sleep. I hate that my hands go to sleep randomly. I hate that I'm hot and I'm cold and I don't know what's perimenopausal and what is EDS, and like I don't know, but I know that if I fix the deficiencies I should start feeling better. So I'm gonna go on all of those supplements and try and really get really healthy. I also am gonna have to treat myself maybe to a new water drinking apparatus. I say because I don't know what kind I want. I don't know if I want like a big one, a little one, a plastic one, a metal one, something with a straw. I'm going to have to figure that out, but I think that would make it kind of fun to try and figure out water again. I did do all of this. It's not like I didn't do it. It's just that, like, I feel like I just went through all of the postpartum depression stuff, and I was just like, I need to eat comfort food, and this is comforting, and, I mean, it's not like I'm crazy unhealthy. It's just that having the Ehlers-Danlos and being unhealthy makes me feel gross. And I didn't know that. And now I do. So we can fix it. So I'll do all those things. I'm also I've been looking for like a tracker, because that's like one of the things I have to keep track of, because I've had the heart palpitation things. I have to find out like how many times a year it happens. I just wanted to let you know that I'm really, really thankful that you're here and that you're watching. And if you are jiving with what I'm saying, if you like any of the other podcasts, go click on the subscribe button and follow me on all of my socials, really. There's a Tickety Talk and the Book of Faces, of course. I've got the Insta and I do the things, but you're going to find me mostly right here on YouTube with the Tiny Titans podcast and on the Tickety Talk and the Book of Faces. If you are a NICU mama and you would like a NICU buddy, a NICU bestie, a NICU BFF, me and another NICU mom, another micro-preemie mom, have teamed up together on the Book of Faces. On the Book of Faces, the group is called Hey NICU Bestie. So yeah, come join us over there. And if you would need a bestie, a friend, someone to talk to, we know all about this. We were there. And we would love to just listen. You don't need to do anything. If you don't want a sponsor per se, but you just want some information, that's over on Hey NICU Bestie as well. So go on and click that button. And also, she was asking about like how long it happens. So in my case, for this heart palpitation thing, what happens, I think it happens like a couple times a year, like every few months or something, maybe like 2 to 4 times a year. But it's happened my whole life, and it's just like I'm sitting here talking to you. I'm not doing anything in particular. There's nothing happening. One time very vividly, I remember I was reading a book. I'm just reading a book. There's nothing happening. No one was around me. All of a sudden my heart feels like it is going to race out of my chest. And I felt like if I was running at that exact moment, that I would actually feel better than I did if I was sitting. And so like I got up, I stood up, I kind of like moved around, and it went away. And so that's usually what happens. But it's like I'll be just laying there watching a movie, I'll be sitting having a conversation, and all of a sudden it is not the same feeling as whenever my chest gets tight. Because I know that's like an anxiety thing. I get that with like when I go back to the NICU, sometimes with like, I don't know, PTSD or something, whatever. I get like a chest tightening kind of can't breathe feeling. But with this heart palpitations things, it's literally like everything else is fine. And that's why it's so weird, is because my heart is literally going so fast, but my breathing is not, and everything else is not, and it hurts. It hurts. So anyway, I did get an echo. I told you that earlier, and everything is fine. They said there was a little bit of like 2 of the valves have like some regurgitation, but if I start getting on the B12 supplement, that is supposed to help vascular things as well. So I think that might help that if I would get on the right balance. The problem is right now I'm like super deficient in all of these things. So I need to figure out how much I need to get in my body to get to normal levels, like balance levels for me. And then how much do I need to take to maintain that while on like a healthy diet. And so that's what the trackers are for. So I was looking up, I need a tracker that I'll actually use, you know. I think something just simple that I can have all of the symptoms and then check off if I had them that day, so that I can kind of count like how often I was fatigued, how often I had the numbness in my fingers and tingling and migraines and all of those types of things when my back is hurting. When my neck falls out, when like chiropractor appointments, when my chiropractor says I'm more out of alignment or I'm doing better, all of that stuff I need to track. so that I know like where I am at. And it's going to take like a long time. I did a tracking sort of when I had my GI issues, and I was tracking with paleo and tracking with calories. Not so much supplements. He was, my GI doctor was very much more like, just eat healthy food. So I'm going to go back to that, obviously, again. But that was tracking, GI symptoms, which I do also have. My GI symptoms tend to follow my cycle. So that's also an EDS symptom, because apparently my body is using more energy during my cycle to try and get everything out that's supposed to come out. And so I don't have the energy to do regular stuff. And so it makes me feel extra junky and really, really gross. But hopefully being balanced out would help all of that. I hope. I really, really hope. Because then I won't fall out of alignment when I'm just carrying my kids down the hallway or to the park, whatever. So, like, I don't know. I'm feeling better about this as we're talking. I am. I feel like I just need a plan, like, to get to the next spot. Like, this was, like, a really weird week. Like, I was very upset and emotional because of all the what ifs that follow the EDS with the premature babies and the incompetent cervix, but we're not going to have any more babies, so we can't really specifically watch me and diagnose me for incompetent cervix. It's just my doctor did think I have it. I did have a cerclage because of it, and so I have that medical history to kind of be like, yeah, she did have all these things. So I can't really pinpoint some of the symptoms that I have had, but I can pinpoint the symptoms that I am currently having and how often that happens. So I'm also going to track the supplements I'm taking and when I'm taking it, so that if I forget and I feel really junky, then I know why I feel junky. I think that's a really good start. And then I think what I'm also going to do is sort of, I'm planning on making an appointment for Carter with a pediatric geneticist, because adult geneticists and pediatric geneticists are different. But now that Carter has a parent with EDS, it may be easier for her to get a diagnosis. It's just she's so floppy all the time. I don't know if they will see it as EDS or just as hypermobile because she's premature. So, like, there's nothing that they're going to do for her having a diagnosis, besides it would be easier for us to get insurance to pay for chiropractic and physical therapy and all of those things. But if I just assume that she has this disorder, we can get her labs done with and without. I don't need a script for that. I can just say, hey, we want to check her out. But we can get labs done and find out exactly what she's deficient in, or if she's deficient in something. But also, like, labs lie. So I don't know. Like, I have some thyroid symptoms that would say that I need to be on thyroid medication. But if I go back to paleo and boost some of these other supplements, then my body might be able to fix that. So, like, this is going to be, like, a very long journey of, like, figuring things out. But, like, I don't know, like, this is just real. This is just how it's happening. Sometimes we do not get a magic bow. Like, I got Ehlers-Danlos diagnosis. Yes, I have EDS hypermobility. That is documented. It's on my chart. But, like, nothing changes. My husband said this exact same thing. He was like, and so what are we finding out? Well, I'm finding out that a lot of symptoms that I've had for my whole life are all connected, and there's a reason for it, and it has a name, and I'm not crazy. Okay? A song has been stuck in my head, and it is Matchbox 20. I'm not crazy, I'm just a little unwell. That's exactly how I feel. I feel like I just am sick. My body is not making what it needs to make to be well. And I just found that out. And because of that, I had all these symptoms through high school from when I started my cycle. And they're finding out a ton of research now, because now we're researching this, that like it does, if you have Ehlers-Danlos in any variation, it can make your cycles incredibly different and painful and irregular, and because your body is going haywire and it does not have the proper building blocks to fix it all the time. And that is like a big giant piece of it, is just your body can't keep up. And so then you're tired, you're exhausted, you feel like you should push through it. That's what I thought. I thought I needed to push through it. I did it to myself. I stayed up too late or whatever. I even tried to gaslight myself after getting the diagnosis. It sounds so dumb. It sounds so dumb to say that out loud, but I 100% did this. Like, maybe they made a mistake. Maybe I am just lazy. Maybe I do just need to push through it. And so I Googled, like, is Ehlers-Danlos overdiagnosed, like, right now? Is it like a trendy thing? I was like, maybe that's why. Everybody has, like, it on the brain, and so that's why that it's popping up right now. And it was like, no. It's like one of the most misdiagnosed syndromes, disorders that there is, because it is so unknown, because it affects so many different systems, because it's just, I'm so used to having to just push through everything and not, like, it helps me in my head to be able to say, okay, you're not crazy, you're not lazy, it's not that you don't want to be productive, it's just that your body, I literally feel sick sometimes. I literally feel sick, and there's no reason. There's no reason for me to feel sick. It's the weirdest thing. I text my friends all the time about it. My best friends, we have that little, the group chat that everybody has with their besties. We've got that little group chat. I'm constantly messaging them like, I feel so gross right now, and I don't know why. Like, I don't know what I did. Is it just because I didn't drink enough water? Is it because my body needs this or that or that? Or like, and then I went to the chiropractor, and I've been going to the chiropractor and then doing the stretches that the chiropractor suggests. Like, all of that is like a journey, because my body is like, well, that hurts a lot, and you did too much just from stretching, because my body is so depleted in all of these vitamins and minerals that my body needs, and without them, it is almost impossible for my body to recover. I'm like hurting myself more. So it gives me a place in my brain to reframe it and say, okay, there's a reason why you feel gross. It's because of this syndrome, and you need to take all of these things to make your body produce what it needs to produce to keep you healthy and feeling good and keeping up with my 2 toddlers. You know what I mean? So I feel like it's a lot. It really is like I got a diagnosis and homework. It's really like a huge relief, and also like a giant mountain that I have to climb up. But I don't know. It is a relief. It is helpful for me to know that I do have it. I was actually talking to my family this weekend about it. We had our family Christmas, and they were over, and I was talking to them about it and like, hey, this is a symptom. You know how you've always told me that this is like a thing for you? Well, it is for me too, and it's tied to this thing over here. You might have it, I have it. We like, I'm not trying to push it, but like for my family specifically, whenever my whole life I've been told that, oh, that's just how our family is, it could just not be how our family is. It is very probably that our bodies, for whatever reason, just don't produce these things, and we need to supplement that, and we should just not feel bad about that. Also, like, not feeling bad about taking a break. Like right now, I'm gonna take a coffee break. Oh yeah. Yeah, it's good stuff. But we shouldn't feel bad about taking breaks and needing to have days off and being like, okay, I worked all day at work and now I need to not do stuff because I hurt, because I'm tired, because I can't mentally wrap my brain around another situation, scenario, conversation. Like, I get tired of talking. Which is really funny because I'm a verbal processor and a female. So they kind of, I'm tired of myself, really. Oh my gosh. I really hope that we can balance this out. Maybe I will not be so crazy and so all over the place. That would be fantastic. And then also being able to be there for the girls. I need to be able to like have energy, like I said. But that's my plan moving forward with me, is to do the trackers, figure out exactly what symptoms I have, how often I have them, and what I need to do to fix that. And then also, I'm going to slowly add in these supplements for Carter because she still is getting, brain freeze. She is still getting G-tube feeds to supplement what she doesn't eat orally per day. So I can just add in, vitamins here, nutrients there. Maybe we need to add some of this, some of that. I think that's what we're going to have to do and kind of just piece it together as we go. I may also get trackers for Carter because not only do I need to try and make sure I know when I'm giving her these supplements, but I also need to make sure I know when she's having like fatigue days. She has really like, it's like a cycle with her. She has like days where she just lays on the floor. She wants to play with you. She kind of wants to talk to you, but she wants to like lay over. Like she can't hold herself up anymore. Which is, again, I thought that was cerebral palsy. I thought that was one of the cerebral palsy. And it could be something else. It probably very much is because we've already done the MRI. I've already talked to the neurologist. I don't know why I keep saying it. It's fine. It's fine. But I also need to track when she's having these like reactive airway asthma type attacks, and how often they're happening, so that we can find out how she's doing like with her BPD and if she's getting closer to clinical asthma or if she's getting healthier from that. Carter still has like 4 years to grow new lung tissue. Kiddos, if you don't know, I have been told by many pediatricians and what's the lung doctor called? Hold on. Pulmonologist, that children grow lung tissue, new lung tissue continuously until they're about the age of 7, and then all of those cells just continue to mature. So if your kiddo, potentially, what could happen, what everyone banks on in the NICU and PICU and little human era, is that if you were to get RSV or RAD or BPD, any of those kinds of illnesses or issues with your lungs, then you could potentially grow out of those things because your body is continuously getting new issues. New tissue. Your body's growing new tissue, not new issues. But when your body replaces the new tissue, it has to just not get damaged. So if your kiddo is getting RSV, and then 3 months later getting pneumonia, and then next year getting bronchitis, and around and around it goes, their tissue is continuously getting damaged. So then it's not actually helping their lungs. So it's like, I don't know if everybody gets told this information, but not only is it important for you to keep your kiddos healthy with like what they're getting as building blocks, nutrition for growing that tissue, but they also can't get sick. So if it's possible to keep your kiddo from getting sick, then they can keep from getting their new tissue damaged, and that should stop the cycle. In my opinion, that's why Cassie has asthma, is because I couldn't stop the cycle. She just got sick too much. She was sick. So in Cassie's case, little tiny backstory for her asthma. She is 8 now. She was born at 32 weeks, and she was born blue, so that she had to be resuscitated, which caused a little bit of damage to her lungs immediately. Then she was on oxygen for like 17 days or something like that. And then when we got home, she got RSV at 5 months. And after she got RSV, it was just illness after illness. She got bronchitis, and then she got double pneumonia, and then bronchitis, and then she got ear infection after ear infection and strep throat, and we could not keep the girl healthy. And so I think that is partially what attributed her to getting an asthma diagnosis, is because every time that she grew new lung tissue, it was damaged by the next illness. So like, that's like a big picture thing that you have to think outside the box. You can't just think, okay, but we want to go on vacation. Okay, well, you want to go on vacation, but do you want your kid to get sick because they went on vacation? I don't know. I'm not saying here or there. I am not in one camp or another. I am very much do what is best for your family. That is what I say for my NICU sponsors. I have got NICU moms that I talk to all of the time. And they choose a different path than what I would choose for my kid. And that's okay. My job is just to be there for them, for what they need and when they need it. Hey, kiddo.
Hey. Carter pooped.
Okay. I'll come change her.
Hey, nice setup.
Thank you. I'm almost done. I can wrap it up pretty quick and then I'll come change her, okay?
Whenever you get down, can we do snack?
Yeah, that would be another thing that we would do. Yep.
Oh, and I didn't find the cord that goes from my headphones to the Zoom, but I did find some, they're like earplugs, but they have a cord that makes the sound. I don't know what they're called.
Okay. We can figure it out.
Mm-hmm. I was using it for a while until my ears started hurting. They affect my ears a little bit.
Okay, maybe don't use them. Okay.
I just need to take some breaks in between. Anyway, I love you.
Love you. Oh, she is a really, really big help. That is the 32-weeker that you just heard. So that is the reason why I think that happened with Cassie. And with Carter, we have bent over backwards to keep her healthy. Yes, she has gotten bronchitis, and she got pneumonia, and she had the flu. She has not had RSV, and she has not had to be readmitted to a hospital. I think I've helicopter mommed her enough to kind of figure out all of her little idiosyncrasies. I just sort of like, no, I don't. My husband doesn't like it when I say that either, but I just sort of know. Okay, she's breathing weird. She's breathing heavy. She is acting not exactly herself today. So I'm going to track all of those things with her. And maybe we need to do it for 3 months and then reevaluate and then see if we want to make an appointment and decide how to move forward. But there's too many options available. There's a lot of questions that we need to answer, and I think after we track everything for a couple months, I think it'll be easier to figure out where we are. Also, it takes a couple months for some of these supplements to even start working in a person's body. So I may not feel good still for like another 2 months, even if I start all of this stuff. Like I've already upped my vitamin D and my iron. I'm getting a magnesium and I'm getting a B12. Gosh, what is that other? I cannot remember. Oh, just the collagen. That's what it is. I'm getting that as well. So I can add all of those things in my diet. I'm trying to do the paleo thing. I'm going to go slowly into that. And take lots of breaks and just give myself grace, because this is going to be a marathon, not a sprint. This is not I'm trying to get skinny in 30 days. That's not what this is. This is my body is not producing what it needs to stay healthy, and I need to fix that. And I know it's going to take a long time to do it. So we're just going to start. We're just going to start where we are and keep going. So it really, really is that the toughest stories start tiny. But those tiny stories, they don't just end after the NICU. There's diagnoses and appointments and misdiagnoses and mystery symptoms that no one can explain for months or years. And I think that is a super important part of the NICU journey. I know it's also, I'm not the only NICU mom who had to wait until after all of her NICU babies were healthier and bigger to be able to focus on her own symptoms enough to find help. But like, that's a common thing I'm finding out. My chiropractor even told me that one time, that they see a lot of kiddos. The kiddos are having issues or prescribed physical therapy or chiropractor for one reason or another. The dads get injured at work. That's what happened with my husband. And then they go to the chiropractor, they start feeling better, and then the moms are like, hey, I also feel gross, and then they go get and figured out that pregnancy does a lot on a woman's body, and you're not always just perfectly back in alignment right after. And if you have some sort of genetic condition, which apparently now I do have, and I know that I have this, I'm just saying it a lot for my own benefit. You can be tired of me saying it, but I'm hoping that you're maybe hearing what I'm saying and not taking it the wrong way. Like, I'm not trying to complain. I'm trying to process this. It's just happened. Today that I'm filming this is the 19th. It's the 19th of December. My appointment was on the 12th. No, Carter's appointment was on the 12th. Mine was on the 11th. So literally less than 10 days ago is when I found out all of this information. So I'm just processing out loud, and maybe it's helpful for another NICU mom or medical mom to just stop and focus on yourself for just a week and track your symptoms and what is going wrong, what could you be working on, what could make you be feeling better. Because it's not just pregnancy that takes it out of you. You know, being in the NICU is exhausting physically, emotionally. It takes years for people to catch up on sleep. I've talked to many medical moms who they're just like, yeah, I'm just getting used to getting like 6 hours of sleep regularly, which is still not enough. So I guess there's not really a way to wrap this episode up with a tiny, neat little bow. You're just going to have to click the subscribe button, and you're going to have to follow the story, and maybe we can figure it out together. I will keep you updated of how things are going. I can even show you my little symptom tracker, and we'll keep up with that. But I think that this is just one of those episodes that's just, we're just going to have to keep moving forward. Thank you for hanging out with me on the Tiny Titans podcast while I process all of this information. I am so happy that you are here. And if you have a NICU story that you would like to tell me, I am all ears. I would love to hear it. Thanks for watching.